farmers, ranchers, and organizations to provide extensive training and resources so farms and food businesses have the support they need to meet state regulations and thrive. Serving Washingtonians is at the heart of everything we do. By offering grants to small farmers and food assistance organizations, we are fighting food insecurity and creating stronger local food systems. At our core, we are dedicated to supporting our state's agricultural industry to fuel our economy while also enriching our communities and safeguarding our environment. This is who we are and what we do.
The average family throws out $1,500 of food every year. That's a lot. Imagine what you could do with extra cash. There are simple ways to reduce your food waste and increase your savings. It starts with a plan and ends with a little creativity, like turning your unused food into something new. Get tips to reduce food waste and make your dollar go further. Know the cost. Use food well. Visit the website to learn how.
Your life sounds pretty great. Don't let a buzz ruin it. Buzz driving is drunk driving.
Good morning. I'd like to call to order this March 4th, 2025 meeting of the Health and Human Services. The time is 9:33. Will the clerk please call the roll?
Yes, good morning. Councilmember Yombe.
Here.
Councilmember Herrera.
Excused.
Councilmember Kruver.
Here.
Councilmember Ayala.
Here.
And Councilmember Hitchin.
excused?
You have 3 members present.
Thank you. With 3 members, and we do have a quorum. Moving on to approval of the agenda. On today's agenda, we have 1 presentation. Are there any objections to approving today's agenda as presented? Seeing none, the agenda is approved. Moving on to approval of the minutes. We have the minutes of the February 18th, 2025 committee meeting to be approved. Are there any objections or any changes or corrections to those minutes? Seeing none, the minutes are considered approved. Now, we have a presentation from Human Services. I'll pass this on to committee staff member Carrie Waterland to introduce our presenter.
Thank you, Chair Ayala. Today you have with you, who is not presenting, but I do want to let folks know in the audience, is Helen McGovern, the director of the Pierce County Human Services Division. And she is here just as a support and I think honor to this presentation that you're hearing today, which is the Comprehensive Plan to End Homelessness Monthly and Quarterly Report. Devin Isaacson, who is the Social Services Supervisor, is here to present that to you. You do have that in your packet starting on page 3. And so if you want to review that, she will also have it on the screen when she's presenting. This is your only topic on the agenda today, and so if you do have questions or anything else you'd like to talk with Devin about, you possibly will have time to discuss those. So without further ado, Chair, I will pass this back to you for Devin Isaacson to come and present.
Wonderful. Thank you so very much, and thanks for joining us this morning. Appreciate it.
Check here. Good morning. Devin Isaacson, Social Service Supervisor for Pierce County Human Services. And as was mentioned, we will be reporting out on the Comprehensive Plan to End Homelessness, both a monthly and quarterly report. Next slide, please. So as many of you know, the plan was adopted in March of 2022 with a considerable amount of help from the community, stakeholders, partners, providers, and Pierce County Human Services has been tasked with the implementation of the Comprehensive Plan to End Homelessness. Next slide, please. With that is some reporting requirements. So we are required to report monthly on project and sponsor descriptions and funding and spend for those projects that were funded through the ARPA dollars on behalf of the Comprehensive Plan to End Homelessness. We report quarterly on stakeholder and partner engagement, and we report semi-annual on the development of the accountability dashboards. Next slide, please. And as a refresh for folks, the 6 goals of the Comprehensive Plan to End Homelessness. Goal 1 is creating a unified homeless system. That is the work that's being done currently for the URA. We ensure interventions are effective for all populations. Prevention of homelessness. Ensuring adjacent systems are engaged in the work and address the needs of people experiencing homelessness. We meet the immediate needs of people experiencing homelessness, and we are expanding permanent housing to meet the need. Next slide, please. This is going to be your Comprehensive Plan to End Homelessness spend through February 26, 2025. I want to point out a couple things since this is the first time some folks are seeing this table. We do have a couple programs that have not spent a majority of their funds, even though the budget is through 2025. That's going to be your pilot program on prevention and your shelter access hub, or the 24-hour Family Promise Shelter Access Hub. Those programs started late. We had to actually procure them multiple times in order to meet the needs of the community and providers that wanted to actually do this work. So there will likely be extensions to their projects so that they're able to expend all of their funds. Next slide, please. So I've got a pretty meaty presentation for you today. The first one, which I'm excited to present, is the 2025-2030 State Local Homeless Housing Plan. Next slide, please. So Washington State requires that all communities produce a 5-year homeless housing plan or local plan via RCW. The previous plan expired in 2024, and the next plan covering that time frame of 2025 to 2030 is due the end of 2025. I know that seems a little bit wonky, but that's the way they develop the plans. The purpose of the plan is to outline goals, strategies, activities, performance measures, and timelines, obviously to eliminate homelessness in Pierce County. Next slide, please. So we met with the Comprehensive Plan to End Homelessness Implementation Advisory Board, or what we like to call the IAB, during multiple meetings in November, December, and January. And it was the wish and request of the IAB and Human Services that we revise the Comprehensive Plan to End Homelessness in order to align it with the state requirements to meet the 5-year plan. As you know or may not know, the Comprehensive Plan to End Homelessness has not been changed or revised since it was adopted in 2022. So it's very timely that we're now in a situation where we would be able to make some amendments and addendums and move the plan forward so that it more meets the needs currently. So what the state has said is that you can develop addendums to an existing plan, being the Comprehensive Plan to End Homelessness, and that you can use that existing plan and structure, but it needs to align with the specific goals of the state plan. And we'll dive into what those goals are in just a moment. Next slide, please. So these are the goals outlined by the state. The first one, and I want to kind of align these with the comprehensive plan for you. We were actually very fortunate because a lot of these goals of the state do very, they capture the state objectives. So the first one is promote an equitable, accountable, and transparent homeless crisis response system. That aligns very accurately with goal number 1 of the CPEH, which is creation of a unified homeless system. So that's going to be your unified regional approach work that is currently going on through Uncommon Bridges. The next goal is strengthen the homeless service provider workforce. This is the one goal where we didn't have alignment with the CPEH. We don't mention it in the current plan, but I think it's a very important goal, and I think it's something that we would want to incorporate and amend our current plan to include. As most of us know, one of the things that providers talk long and hard about is either lack of staff retention, and really acquiring talent that can do this really hard work. Turnover can be a challenge. The next goal is prevent episodes of homelessness whenever possible, which aligns with, sorry, I need to flip my page. With prevent homelessness in the CPEH. Prevention is going to be a very necessary and important part of our homeless crisis response system in 2025. It's really trying to get upstream of a crisis. The next one is prioritize assistance based on the greatest barriers to housing stability and the greatest risk of harm. That is going to align with ensure interventions are effective for all populations. Embedded in that ensuring interventions are effective for all populations is really where your equity lies. So what does it look like for target populations such as those folks that are chronically homeless, families, youth, BIPOC folks? How are we providing individualized services to meet their needs and really address that disproportionality that they experience in our system? The last one is seek to house everyone in a stable setting that meets their needs, and that aligns with goal 6, which is expand the permanent housing system to meet the need. So again, we were very fortunate. These goals align very accurately, and I think that will make this project even more enriching for the CPEH. We will be sharing the mapping document and any other materials that Council would be interested in seeing as this process progresses. But again, it is very exciting to think that we can amend our plan and move some of these great projects forward into 2025. Next slide, please. There are also some components which will help us to plan. The first one is estimates of service levels. That really has to do with what is the need that falls into intervention types that we're offering in the system, such as rapid rehousing, permanent supportive housing. What do those levels need to look like to make the most efficient system? The next one is survey of fund sources, and really all that means is what is the system receiving in grants and awards, state, local, and federal, and how does that align with the service levels that we want to reach? Next slide, please. We then go into estimates of permanent and emergency housing needs. I think really that is the goal, is to understand what the need is and a pipeline of those services so we know when they're coming online and how they're going to impact the homeless crisis. The next one is prioritization criteria of homeless housing capital projects. Again, these two align very closely together. It's creating that pipeline and knowing what's coming and finding those capital dollars to fund those projects. Next slide, please. And then, of course, a very, very big component of the drafting and development of the amendments for the CPEH is engagement. So what does the community think? What does our leadership think? What is their feedback for the goals and strategies that we are going to align with for 2025? We have to provide a public record of all of that engagement and our outreach efforts. So it's going to be crucial to the plan. And then very soon, I believe Wednesday, a notice of plan development will be going out in a press release. And that's just to let the public know and give them awareness that we will be working on this project in 2025. Next slide, please. All right, and this is all the folks that need to be involved. So we do need the two largest cities within the county or multi-county region. Now the good news is the IAB is the task force for amending the CPEH, and we do have City of Lakewood as well as City of Tacoma as members on the IAB. So for all intents and purposes, we are meeting that requirement currently. We need one or more representatives from the following. That's going to be lived experience of homelessness, behavioral health administrative service organization, a by and for organization. Next slide. Emergency shelter operators, all of these are going to be providers, which I think is crucial to the plan development. Domestic violence or sexual assault shelter and housing, homeless outreach providers, rental subsidy administrators, permanent supportive housing providers, and coordinated entry staff. So that does cover the gamut of intervention types in our system. Next slide, please. And this is where you come in. So in order for this plan to become finalized, we have to hold a public hearing prior to the adoption. We have to ensure the local plan is adopted, and then we have to submit the final plan or addendum to Commerce by December 2025. It does have to be approved by council and blessed by the executive office as well. And to, I guess, throw a wrench in it, you have the budget, which also needs to be approved during this same time period. So there will be some planning that will need to happen in order to make sure that it happens in December. Next slide, please. And I will just say that about 90% or more of our funds come from the state for homeless services. So it's definitely an important part of meeting the state requirements. And then this is what the local plan timeline looks like. So we are in the vision stage. We have drafted some strategies and action items to meet the goals of the state plan. We are setting objectives, and we are recruiting partners and providers to be a part of this work. Q2 is the data stage, so there will be a lot of gathering of information that really aligns with identifying system need, as well as accountability and how we hold ourselves accountable to the actions that we put into the plan. Q3 will be drafting the plan and establishing prioritization criteria. And then Q4, of course, October, November, and December will be completion of the plan, public comment, and adoption. Next slide, please. And I will pause there in case there's questions.
Do we have any questions? Let's, we can continue on and I'll have questions.
Okay, great. So next I want to talk about some 2025 homeless initiatives that are going to be happening. We've got some pretty big projects happening in our community in 2025. Next slide, please. The first one is we are embarking on a coordinated entry project. Coordinated entry was last evaluated by a third party in 2016. So it is definitely time for us to look at our system again and determine whether it's meeting the needs of members that are, or clients that are needing to utilize those services. So that begins in March, and it's really focused around identifying disparities in our coordinated entry system. We did some preliminary data assessments and evaluations, and we did find that special populations are experiencing some disproportionality in coordinated entry. So those are really going to be our focus areas. But there's some other things we're going to be looking at as well. One of those is creating a youth-specific coordinated entry system that is a best practice nationally, and so we want to look to incorporate that into our system. And we will also, actually we started in January rolling out by name lists. By name lists are essential and crucial to getting you closer to functional zero. You obviously would not know if your inflow and outflow have reached an equal level unless you are tracking that through a by name list. It's also an amazing way to get people the individualized services that they need and ensure that they're not falling through the cracks of our system. Next slide, please. We also were awarded the Youth Homelessness Demonstration Program, or YHDP as we call it. We have incorporated a third-party consultant to help us with that work. We will be writing a coordinated community plan, and this will involve a procurement for services for youth and young adults. That could be rapid rehousing, transitional to rapid and permanent supportive housing. We're also bringing on a new staff member to our homeless team to really focus in on youth work. And helping us to build a homeless crisis response system that really meets the needs of youth and young adults. And again, there's goal setting for functional zero, so it's an important project. Next slide, please. And then in coordination with YHDP, we also are in the middle of a 100-day challenge. That is essentially a ramped up initiative to house as many youth and young adults as possible during that 100-day time frame. And it's really to build out creative and flexible solutions to house youth and young adults. So those two things will be going on at the same time. Next slide, please. And then last, we have our Eviction Prevention Randomized Controlled Trial, or RCT. This project is ongoing, started in 2024, and it really is testing the efficacy of prevention, and again, as I mentioned, getting upstream of the homeless problem. So it's going to give us some ideas of what works, what doesn't work. There's a strong component of case management in the RCT, and so that's going to help us to understand what the needs really are in the community for those people seeking prevention services. Next slide, please. And last, unless I should pause. No? Okay. Last is our Q4 2024 partner engagement. So this really is an opportunity for us to inform you of the IAB meetings, the Continuum of Care, or COC meetings, and then any other community engagement that we are involved in the name of the CPEH. Next slide, please. So first, we have our IAB meetings. So in October, we worked on membership governance and system mapping. Just so you are aware, the IAB started in 2021, and since then, we've lost about half of our membership. Considering they are the task force to develop this new 5-year plan and amend the CPEH, it's crucial that we open up membership and, most importantly, diversify membership so that we have representation of lived experience, people of color, and really just making sure that we're covering all the necessary and special populations. We also worked on the select committee, or reviewed the select committee on homelessness presentation, and then we did some reporting on inflow, outflow, and exits, and determining a cadence for reporting out that information. That information was presented to the select committee on homelessness, and if that's information you would be interested in, we can certainly bring that to this group as well. And how this all coordinates with the CPEH is the IAB is really tasked with implementation of the plan and staying connected to all the different projects that are happening in the system as they relate to the implementation. In November, we introduced the state local plan when the guidance came out from the state and talked extensively about what it would look like to use the CPEH and amend it. Our IAB members were very happy to move forward in that way, and we did get executive leadership approval to move forward in that way. We talked a lot about severe weather response. That really has to do with meeting the immediate needs of people experiencing homelessness. And we are working still on severe weather response, and we'll be rolling out a new plan in time for summer. We're making some improvements. We are putting together a task force. We've really got a lot of great ideas to improve how we're responding to severe weather in our community. And then we talked a little bit about the shelter stand down for the city of Tacoma, and really tried to determine what that's going to look like for the system. Next slide, please. And then in December, we talked extensively about the YHDP, or Youth Homelessness Demonstration Program. We planned for what it's going to look like for the IAB to be engaged in that work, and then, of course, how it aligns with the plan. The way that it aligns with the CPEH is that is you're meeting the needs of those people experiencing homelessness with a focus on target populations. We talked about the coordinated entry funding recommendations, which were finalized, I believe, in November for 2025. And we discussed, again, the positioning of the CPEH with the state and local 5-year plan. That's when we really started mapping strategies and goals with what the strategies were in the CPEH, which is how we got to the mapping document that we have currently. Next slide, please. And then we move on to our continuum of care, or COC. So we had 3 meetings in Q4 of 2024. October, we talked about technical assistance. If you're not aware, in 2024, we engaged in HUD technical assistance to help us roll out a new governance structure for the continuum of care. That was approved in January, so we are going to be working on rolling that out in 2025. That really has to do with membership, assignment of duties, an MOU between Pierce County Human Services as the collaborative applicant, as well as who would be charged with HMIS data and coordinated entry planning, which are all 3 Pierce County Human Services. We also talked about the City of Tacoma's 5-year plan for CDBG home and ESG programs. And we discussed the 2025 homeless point in time count, which, as you all know, was held on January 30th through a big lift. Over 300 volunteers were signed up. I know some of you were there, so thank you for volunteering. In November, we talked about the COC strategic plan, again, the homeless point in time count, and we introduced an equity policy of the COC. The reason that's important is because at the end of the day, the goal is to increase COC funding. We were awarded $4.9 million in 2024 for the 2025 year. That was an increase from the prior year, but we would like to see more of those funds. That does not include YHDP, which will eventually roll into the COC funding. All of these strategies, policies, things that we talk about are really in the name of increasing that funding, which our system needs and does align with the CPEH. And then in December, we talked about the homeless point in time count again, and the governance charter. Next slide, please. And then last for partner engagement was a November 1st community kickoff. We invited all of the providers. As you know, we did have a big event this year as well, but that's not on here as it didn't fall into Q4. We announced the YHDP award. We established next steps. We discussed with the Pierce County Youth Action Board, who is, by the way, tasked with the decision-making power of the YHDP grant. So they are actually going to be the ones that approve funding recommendations, approve the coordinated community plan. They really are in the driver's seat. And so they are sort of at the center and heart of the work we're doing for YHDP. Next slide, please. That's it.
Wonderful. Thank you so very much. I'm going to ask and see if we have any questions from our committee members. Committee member Kruger.
Thank you, Chair. I made lots of notes the other night, and so I hope I can make sense of this. But first, I want to start. Did I understand that the youth are going to be making like financial decisions?
That's correct. With the help of the collaborative applicant, which is Pierce County Human Services.
Interesting. And you mentioned a governance charter. Has that been drafted? Or is there a form of a draft on that?
It is actually finalized and was voted on in January.
Did we get a copy of that?
If you did not, you can.
I'd like to.
Yeah.
If we did, I missed it. And the IAB, would you, that stood for what, Action Board?
Implementation Advisory Board.
Yes, implementation. Okay, I'm trying to get all these acronyms. So they are like kind of the monitors of the project. Did I understand their purpose correctly?
They're considered our task force. There are some members that are missing that we will need to recruit and add so that we align with the state requirements. But yes, they are our task force. They're not ultimately the ones that will adopt the plan, but they will help us to develop it and amend the comprehensive plan. And then we will move into an approval phase, which will happen at a leadership level with the council.
Okay, and for the public engagement, I notice, I mean, it's kind of inherent in every organization in this public outreach where they want everybody at the table kind of a thing. But, you know, to me, this kind of system or this need is more specialized and not everybody really has input on it. And I'm concerned with the push just to get bodies there to say we had public engagement. I don't know if that's particularly proper in doing that. Are you seeking engagement from more of the communities that maybe have skin in the game in that, you know, they're going to be charged with funding a lot of this program so that they know what's going on? Or is it geared more towards people whose heart is specific to homeless?
It is geared more towards the provider, community, advocates, grassroots folks, leadership, but there will be a community-wide invitation to attend. We're going to be having 3 community sessions where folks can come and engage. They will not be making decisions on goals and strategies, but they will be giving feedback for the goals and strategies that we present to them. So there is, I would say there is a focus area, but it does have to be open to the whole community.
Okay, it's such a big topic. It's kind of like, I guess, you know, asking the community to come in and comment on coaching a soccer team, even though they don't know anything about soccer. Yeah, you know, what kind of input are you going to be getting? Going back to where there was the note for a name by or a list by name, and is that for the purposes of similar to like understanding if someone's on a certain medication that you have a record to know that that won't mix with something else, and so this person has a record that if they are over here and end up here, they can get and they need help. There will be a connection between the needs so that things don't get either duplicated or it's something that doesn't work for that person.
Yeah, you're spot on. It's wraparound case management. So it's bringing together, and I failed to mention this, but part of managing a by name list is weekly conferencing, where you're bringing all the providers together that are working with those folks on the list. You are determining things like what kind of supports they need, things maybe they're not currently getting support with, locating them. Believe it or not, a lot of folks that get housing referrals can't be found once they get the housing referral. Keeping their coordinated entry assessment active, because once you have 90 days, and once you drop off the list, you wouldn't be eligible for a housing referral anymore. So yes, to your point, it's bringing all the providers together, individualizing the services that they need, and really making sure that they are getting mental health services if they need them, that they are getting substance use disorder services if that's what's required. So yes.
And what is a shelter stand down? What I didn't understand that term.
So those are the shelters in City of Tacoma that are going to be shutting down in 2025.
Over by the highway?
There is,
when I visited,
not the stability site, no, but there are several that are going to be shutting down in 2025. I know I don't have the list in front of me, but I can definitely get that to you.
And they are closing down because?
Some of it's funding, some of it's because they're transitioning to new projects, such as Shiloh Baptist. They're actually going to be rehabilitating and turning into a permanent supportive housing program. There is some other programs where the building is not able to support shelter, emergency shelter, because it was stood up during COVID, different things like that, but the primary is funding.
Okay, so the permanent supportive housing at Shiloh, that is subsidized?
Yes.
Or they're, okay. And okay, what is that? Dallas Charter. I'm wondering, so this has been several years in the make of putting all this hard work together, and I can't imagine that it seems things, moving goals or moving parameters. Have you had comparisons to other places in the country that are doing the similar kind of program, and maybe point out what is special here that maybe hasn't been encountered in other areas, or how other areas have encountered something we have here and how they handled it? Have there been coordinating efforts in understanding what goes on elsewhere?
Yes, I know that was a part of the original development of the comprehensive plan, and it will be a part of this plan as well. When the state sent out their guidance, they sent also several resources for us to look into for best practices, what other communities are doing. So that will be an element of it, yes.
Because I've mentioned before, I'm just really concerned that most places I've read about, there hasn't been a reduction. It escalated, and I just don't know what the capacity is here for our ability to have. I mean, this is just like amazing services that I'm hearing. For emergency shelters and locations of services, is there a map that has been put together that is pinpointing the plans on where, how about we put one here, one needs to go here? Is there something like that that has been drawn?
I'm not sure. I would have to get back to you on that. I know it will be part of this planning process because they want us to evaluate opportunities for new emergency shelter as well as evaluating existing emergency shelter. I would imagine that a mapping document like that has been done in the past.
And I'm just concerned because I have heard more than once that there has been obstacles with the village that is in Ording because there is no way to get services. And if there are plans to move things out into the rural area, what will they do? Because we don't have the transit, we don't have the jobs, and I don't think it would be serving the purpose by moving things out away from where the services are, which is, I guess, part of the pros and cons of being a city. And the aligning with the commerce requirements. Do you recall were they all the same, or were there things different that might give them pause to approve what was done? I just didn't see a list of what other commerce requirements, or maybe if you have one that you can just send that.
Yeah, it's those 5 goals.
That was it?
Well, there's other things in the guidance, of course. There's a lot of the components that we went over is also a part of the package that we have to present, as well as those 5 goals that are outlined.
Okay. And I think on page 9 it had mentioned about seeking to house everyone. That's quite a goal. what was the number estimate on the need these days?
So in 2024, our coordinated entry system served about 8,800 people during the course of the year.
Okay, those were like single residence people or people in families?
Everyone. So that could be individuals, couples, families.
Could be a family of 5 and
It was
2
individual
cases.
head counts, if you will. Yeah.
Okay, that's amazing. And was it estimated about how many could be housed with the dollars available?
That will be part of this, the
study.
evaluating system needs. Yes, we will be going into that in more detail.
Because I have kind of a concern too on the availability of land on where these things can be built, plus provide housing for people, other people moving here. It's difficult to balance that. And do you have estimates on, and I'm trying to, I don't know how to balance that. This is, and folks that get housing and then they work their way up and they no longer need to be in subsidized housing, what happens? Do they have, do they get a different home and then that home is reoccupied by someone else who needed assistance? Or how, because I'm just, what is the ratio of subsidized housing versus non-subsidized housing? And at what's growing faster?
So your first question, I'll answer that one first. So when someone is no longer in need of a housing program to support them, they get exited from that particular program, and their system records that exit to permanent housing. So we actually know who's moving out and no longer needs programmatic support in the form of rental assistance or permanent supportive housing subsidies, those type of things. So that's how we're able to track that. And then yes, that unit or apartment or whatever the housing looks like would then be reoccupied by a new person that was in need of permanent housing. And again, we track all of that in HMIS, so we're able to kind of see the flow of folks through the system. As well, unfortunately, as well as people that are not successful, because that does happen as well. Your second question, if you wouldn't mind repeating it.
I think, well, I have another one that I was thinking of as you were answering that, and I'm wondering, do you look at the capacity of the schools as you look for places to get housing? I just don't know if there are any schools that are losing students to where maybe those are the areas that should be looked at in finding housing because they're a school that has capacity to take the children.
Yeah, so schools are complicated. OSPI does limit the amount of data that we can look at because that is protected data, but we do work with McKinney-Vento liaisons in our community who are serving those folks. And the data for the number of youth experiencing homelessness or McKinney-Vento qualified, which is the federal act that protects all students, they are tracked and we do know the numbers. Unfortunately, a lot of the McKinney-Vento qualified families don't meet our system's eligibility for housing services. And what I mean by that is that we serve category 1 of HUD, which is literally homeless. So living in a place that is uninhabitable or in an emergency shelter or transitional housing. And we serve category 4, which is those folks fleeing domestic violence. Categories 2 and 3 are imminent risk, couch surfing, those types of things. And so that middle category is where a lot of McKinney-Vento families fall and where our system is unfortunately not able to serve them. And to your point about, so there is a challenge with McKinney-Vento because if a family does obtain housing, oftentimes they obtain it outside of their school district, and they're challenged then with having to find a way to transport the students to their school district, or they have to leave that school district and start start in a new district. Does that answer the question?
Yeah, I know it's kind of, it's hard to have a hard answer on so much of it because there's so many moving pieces. And I think I believe I had a question on page 20. Is that, I wonder what I was looking at. Oh, it was probably the packet, but it had mentioned about, the youth coordinated. Are these emancipated youth?
Some could be, but no, not generally speaking. They can be emancipated, they can be still under their parents' guardianship, but when we say youth, it's a term that encompasses 12 to 24-year-olds. So there's actually, up until the age of 24, you're still considered a youth. And a vast majority of the young folks we serve in the homeless crisis response system fall between that 18 to 24 age group. Those can also be pregnant and parenting youth, but that is the actual definition, so it goes up to 24.
12, you said, not 13, 12. And have UBIs been discussed amongst the discussions in ways to assist the families?
UBIs?
Universal Basic Income Vouchers.
Oh, I'm sorry. That isn't actually something that the homeless team would administer. However, we are in conversations about different ways that we might be able to start what we call direct cash transfer or guaranteed basic income program for youth and young adults.
UBI, okay.
Yes, it is a best practice, and there's a lot of communities across the country that are trying guaranteed basic income programs for both families and youth, and they've experienced some successes. So I would love to have a program like that in our community, whether it be for families, youth only. I really think it can be something that makes a big difference.
Okay, thank you.
Funding is always the challenge, right?
Well, that's where we up here are, with dozens of organizations that are in many different entities besides housing that we try to balance, and it's very difficult. So that's all I have at the moment, but I'll reserve future questions. Thank you for your time.
Of course, thank you for the questions.
Committee Member Yambe.
Thank you, Devin. Thank you, Devin, for being here and doing that great presentation. And to my colleague, Committee Member Kruber, I'm just going to ask a couple of clarifying questions just because there were so many that kind of are related. So first of all, I think on it's really exciting about the youth homeless demonstration programs and the opportunities that we're going to start addressing a really important population of the community. So the youth who are doing the consulting and giving input, I assume is those who have lived experience, who are helping give ideas. It's just like when we have other people who've experienced homelessness before, those who have experienced it are often the ones who have utilized those services and seen gaps or have seen experiences where maybe that those powers that be missed some things that were important in navigating some of our complex systems to get support or housing. Isn't that why that group is included on that one?
Absolutely. Every member of the Pierce County Youth Action Board has lived experience of homelessness. Most, or if not all, have experienced it in Pierce County. So they know the system pretty intricately, I would say. And they really are coming to the table. As you know, youth voice is so different than older adult voice, right? The information they bring to the table is oftentimes very eye-opening and brings a whole new perspective to the work that we're doing. So yeah, it's very important. It's actually federally required. So it's not necessarily an idea that Human Services came up with. It's required by HUD. And I would also add, because I didn't mention this earlier, but the Pierce County Youth Action Board helped us write the application for the funding. They wrote like a majority of it, and then they had to endorse or bless the application. So they read the final version and gave us the go-ahead to proceed with that application. So
That's great. And then the eviction prevention randomized control trial, is that the thing that in the local media referred to as the lottery? Is that the same thing?
it's related.
Okay.
So the lottery is the mechanism that we use to determine who will get services for eviction prevention. And that is part and parcel of what the RCT is involved with, as well as the state. Those are state funds, and the state in the coming years will be changing the way that you determine eligibility. So there's a lot coming with eviction prevention.
Okay, because it was, I remember before I got on this esteemed body that I read that, Pierce County has one of the highest rates of evictions in the state, and then, with like 12,000 renters, or what is it, 121K renters in the county, and that's like the second highest in the state. So, and then the eviction amount, it seemed like it was 2.9 per 100 residents, which I was like, wow, that's much higher than a lot of places. So that was kind of alarming. But yeah, I appreciate that. And the last question is I remember reading that there was some coverage of the, let's see, get the acronym correct, the COC, and that there was some report done about how we should pursue or streamline or improve our COC system in Pierce County. Is that, it seems like that's ongoing, right?
Yes, and actually we started our technical assistance project in 2024 to do just that, improve the COC, make it as functional as possible, make sure the partnerships and relationships are as strong as possible, ensure that we have all. COC is, I could talk about it all day, right? But the COC is a pretty complicated system because it is a federal mandate. But essentially, you are evaluated each year on your COC application by many different things. System performance, do you have all the policies and strategies in place? You get dinged if there's certain policies that you're missing in your COC, your ability to meet the needs of people in your system. There's just a lot that goes into it. And so all of that really hinges on the functionality of your board, and that's kind of where the governance charter came in, as well as the MOU, which is under review right now between Human Services and the COC. There's never been an MOU in place between the collaborative applicant and the COC, and really, the way that helps is it really outlines who's in charge of what in order for us to meet some of these goals and hold each side accountable. And those are all things that improve our score and increase our funding. So we're headed in the right direction. Still some work to do, but we're definitely headed in the right direction.
All right. Well, thanks a lot, Devin. I appreciate it.
Of course.
Thank you so much for that. It's my turn. I have several questions. Excuse me. I do want to say, I began my career in doing homeless youth work as part of a homelessness coalition. So I'm restraining myself in terms of the nitty-gritty kind of questions, but it's something that I will follow up with you later. I'm curious about, I'm just going to go page by page on the application. I'm curious for your pilot program on homelessness and the 24-hour shelter hub. You mentioned that those began a little later, so there's going to be some extensions. What's the timeline of those extensions?
So we really need to have those conversations. Can I say one thing first? I actually worked in youth homelessness for 9 years. So you may have questions I can answer, just so you know. But going back to your question, in terms of the shelter access hub and prevention, we need to have those conversations with the provider a little bit closer towards the end of the year to say, what do you anticipate the extensions needing to be? How much longer would you need to spend those funds? And then most importantly, and this isn't a provider conversation, but we need to have those conversations about how we're going to sustain those two programs, because those were ARPA funded, and as you know, those funds are not coming back. So how we retain them in our system, they're both proving to be very effective.
Great. Then I'm curious, you defined youth as 12 to 24. Is that definition the same across all programs and all funding streams?
No, every program has, or every funding source rather, has sort of different eligibility associated with it. For YHDP this year, round 8, it's 18 to 24. They changed that. It used to encompass that full age range. And when they rolled out the program this year, they said it will only serve 18 to 24. So unfortunately, unaccompanied minors are not included. We have some state funding that's 18 to 24. Some of that has to do with the legalities of offering housing to minors. There's some Washington laws that don't allow us to do that. They can't go into a lease on their own, as an example. So really with unaccompanied minors, you're focusing more around family reunification, creative ways to get them maybe from couch surfing. You have to be really creative with the unaccompanied minors. Yeah.
Thank you. I'm curious what membership recruitment for the IAB looks like currently, and then if there's any changes for the future.
Yeah, so what we're going to do, I worked with the IAB to draft a membership application. What the IAB determined is they wanted it the lowest barrier and simplest form of membership application that it could be. In the new governance or bylaws that we recently passed, we have a composition requirement for the IAB, and it outlines, that I don't have it memorized, I'm sorry, but 30% of membership must be people with lived experience, as an example. We are looking for Pierce County Youth Action Board members. We have to have jurisdictional involvement, those types of things. And so when we open up that application, we're going to have to map that to the bylaws and determine what the needs are going to be on the IAB.
And then, let's see, you talked about the HUD technical assistance. And the recommendation for, or the support for a new governance structure. Can you share how that governance structure is different or would be seen different than any of the other tables that we have?
Yeah, absolutely. So the current structure is that we have a very large board with 2 chairs. It creates a little bit of inflexibility in terms of being nimble towards the needs of the continuum of care. The new governance is a smaller board, larger membership votes to approve anything, but you have this smaller sort of higher functioning board. There was some concerns. It looks like it'll be somewhere between 13 and 25 on the board. Those folks will vote, but ultimately the decision-making power is in the membership. And then open to all members of the community for committee work.
Gotcha.
Yeah.
And then I just want to mention, and I'm sure, obviously, one of the biggest factors in homelessness is that social network and social support. And we know that there are so many services for that 18 and younger space, such as McKinney-Vento, and even just the definition of what being homeless means if you're 18 and younger versus the second you turn 18. Those definitions change and those support and permissions change. And so there's such a huge opportunity to really not necessarily stop that in the 18 and younger space, but have a lot more interventions. And so your comments about having some basic income for 18 and younger to really prevent that is huge. I'm curious, even in that space, and you didn't talk about it today, but I'm curious if there's been any conversations about transitional housing and what transitional housing can look like for those critical age areas.
So we have talked, YHDP does include transitional housing and transitional to rapid rehousing with the program dollars that we were awarded. It's very much on the table, I would say. We would need a provider that applies for it. Now that would be the 18 to 24 age range. But what that does is transitional housing is up to 24 months. Rapid rehousing is up to 24 months as well. And so you're creating this continuum for young people to be able to recover from the crisis of homelessness, as you know, and then transition into something that is more their own through the rapid rehousing intervention model. I would love to see providers apply for transitional housing. I hope that they do. I'm certainly encouraging folks along the way. It used to be a model that had used all the time, and then they moved to housing first and transitioned over to rapid rehousing. But there's some evidence in, nationwide that transitional is a best practice for youth.
And then lastly, sorry, I'm doing this from memory because I can't find my notes. You talked about new to the new plan would be the focus on that retention of staffing and what direct service looks like. Is there anything that you could share just in conversations that have happened thus far around what a strategy or where that energy is really taking staff in?
Yeah, I can tell you some of the conversations that I've had with the IAB about what that might look like. I actually have some of those notes here, so give me just one moment. So some of the strategies we talked about is promoting providers to include increased wages in their funding applications. Believe it or not, the county doesn't actually say, this is the rate that you pay and you can't pay over this rate. We don't have a restriction like that says you can't pay over $25 an hour for staffing costs, right? So, communicating that out to providers and promoting it to them when they're applying for funding opportunities. We also have talked about different strategies around, for example, the Maureen Howard Affordable Housing Tax. We're actually going to be procuring that soon, and that is an investment into services for those people that are currently in permanent supportive housing. And so a program like that where you're increasing services could also increase staff and would then decrease staff burnout for those folks that are working in permanent supportive housing. Permanent supportive housing is a very intense case management job, and I think something like that could help them when you have the more staffing. Basically, the smaller ratio for case manager to client is going to encourage retention of your staff. Burnout will decrease. We've also talked a little bit about how we can set some parameters or more actively engage performance targets with our providers so that when they are spending through their grant dollars, they're incentivized for meeting certain benchmarks like ratios. So that's one thing that we've talked about. That's sort of a systemic thing that you could put into place to encourage providers to hit some of those benchmarks. So that's a couple. There's more, but yeah, is that helpful?
Yes, very. Yeah. Thank you. We have more comments from Committee Member Krueger.
Thank you, Chair. Thank you, Chair. Thank you, Devin. You're doing a great job. It's like, knowledge is like an encyclopedia here.
I know.
I'm like, wow. Going back, did I read somewhere that the eligibility needs to be nonprofits that would be providing the services?
For just homeless services in general?
Correct. I mean, the program requires nonprofits to be, utilized or contracted with.
It is typically nonprofits. It depends on the funding. And you're talking about funding that comes from Pierce County, correct?
Well, any of the funding. I just was thinking I had read where that only nonprofits need apply because nonprofit is not profitable. And I sit back and I think if there is a regular company that is not a 501c3, but their earnings are less than what someone is earning at a nonprofit, then why can't they also apply for these kinds of jobs? And I just didn't know if you were engaged in that arena part of it, or if you've even discussed that part of the criteria. Okay. And is there an expectation, like on how long, or maybe not expectation, but is there an average on how long someone is maybe in the supportive housing before they can move on and get on their own feet and get out? Is it like 6 months, 5 years?
It's a good question. So for permanent supportive housing, they can actually be in permanent supportive housing forever, as long as they qualify. For rapid rehousing, there is some discretion with the providers, so they could give rental subsidy for 6 months, and then the client starts taking over some of their rental dollars themselves and starts paying for it. That helps people to be prepared for when they exit the program. But rapid rehousing can be up to 24 months, and that's the maximum.
On that, okay.
Yeah.
And I guess I just need to dig deeper into the permanent supportive housing concept. Is that like Salishan or Salishan? Yeah.
There's different, so you have Section 8, which is different than permanent supportive housing, but permanent supportive housing, this is going to get a little bit confusing, but permanent supportive housing could have a voucher attached to the unit. But permanent supportive housing, the requirements are that you are chronically homeless before program entry, and you have a documented disability. So you cannot get into those permanent supportive housing units without that. Permanent supportive housing also is required to have case management. It's not required that the client use the case management, but it's required that the provider provide that case management. So it's a long-term supportive housing structure for those folks that have the absolute highest barriers. Mm-hmm. So when you think about folks that we see in encampments or have been chronically homeless for years and years and years on the streets, that really is going to be the most helpful to them and probably the most supportive to them. It's not always the case. Rapid rehousing could work, diversion could work, but when you're dealing with maybe co-occurring ailments or something like that, you really may need those wraparound supports.
And I believe I have heard situations where some folks, they get into a housing situation and then they start inviting friends. Is that monitored? And then I've also heard where for some that get a house or housing and it's just not their lifestyle and they leave and maybe somebody else takes over. Are those kinds of things monitored?
We don't necessarily track when someone exits a program if it's because they've moved folks into their housing. We would exit them and say they did not exit to permanent housing, right? Unfortunately, they were not successful in this program, and there could be a variety of reasons that might be the case. I know that does happen. I couldn't speak to how often it happens. The requirements are that we don't see a 30% return to homelessness for those housing programs, so that's what we require as a system. And I don't have the data in front of me, but I believe that all of our providers are meeting that. I would have to check and get back to you.
It's not.
But yeah, it's a return to homelessness is what we benchmark.
And then I just recall you having said on one of the incentives, and like there's no law that says you can't pay them more, but I guess I'm looking at, we have so many laws that are increasing the cost of living, and I would rather have a cut in my cost of living than a raise. And I don't know if you ever point things out or if there are ways to, I guess you can't really lobby, but when there's a constant etching up of costs to taxpayers, they would want to pay more, but they just may not have the capability. And I don't know if you ever express those ideas, or really maybe it's just wishful thinking on my part, but in identifying ways to lower cost of living.
Yeah, typically it's not something that our homeless team digs into.
Yeah.
We really are addressing majority those people that are literally homeless, and then working on strategies for workforce development. So how can we get them employed? How can we increase their income? So that's kind of our focus areas. Yeah.
Okay, thank you. Thank you, Chair. I think I can rest now.
Thank you.
Thank you, Debbie.
Any other comments from committee members? Hearing none.
Close
Thank
it
you so very much for coming in and answering all of our questions. Really appreciate it. And please extend our thank you to everyone on the team that is doing this work. I know everyone's working pretty hard on it.
Thank you.
Thank you. We are going to move on to our next agenda item, other business. Is there any other business from the committee members or staff? Nope.
Thank you, Madam Chair. The only other business to raise to committee members is that next week, March 18th, Health and Human Services is canceled. And then you will resume on April 1st. And I'm working with and meeting with the department and their Aging and Disability Resources team to solidify what your next presentation will entail. But it will focus on elder care, aging well, really looking at the senior services currently available in Pierce County, how they're funded, those sorts of things for you to have the presentation. It will be much like today in that so far we don't have another slated presenter, so there will be ample time and opportunity to ask questions for those presenters.
Okay. Not next week. 2 weeks.
Thank you. So let me correct myself. Not next week. It will be April 1st.
April 1st.
Yeah, but I mean, as far as 2 weeks, we don't have a meeting. Not next week.
True.
18th.
Thank you. Thank you for helping out and clarifying. For everyone listening, here is the situation. March 18th, 2 weeks from now, I appreciate that, will be canceled. And then almost 4 weeks from now, you will resume on April 1st.
Wonderful. Thank you so much for that.
That is not a joke. That is serious.
Very serious. And thank you for the phone a friend buddy system. Appreciate it. With no other business, we are adjourned. Thank you.